Welcome to the second lecture on Phonetics and Phonology, broad overview, NPTEL MOOCs course. In the previous lecture, we went through the basics of sound and sound representation in linguistics. So, we looked at the problems of sound versus spelling. So, how writing systems represent them, the sounds that is, and how actually we produce them. And very often there may be irregularities in that representation. And we showed, for instance, how the English system, the writing system, can be very irregular, and very often it shows that the alphabets actually do not represent the sounds systematically across the writing system. So, you would see in the previous lecture that whenever there is a GH sound, it can be sometimes pronounced as f, sometimes it's silent, and there is always that inconsistency, and that's not just with regard to one sound, it's across the writing system of English. Now, because of that, there are various degrees of these irregularities across writing systems. Some systems are more inconsistent, some systems are more consistent. However, linguists need a system to represent the sounds of the languages of the world, and that is called the International Phonetic Alphabet. And we showed a bit of transcription as to how the sounds are represented. We showed with the example from English consonants, what are the symbols that are used for a few English consonants which are not there in the writing system of English. And again, we talked a bit about phonetics and phonology and what are these two branches within linguistics, how we understand phonology vis-a-vis phonetics, and what are the domains that come under these two branches. And finally, we studied a bit about consonants, consonant production. Now, in the second lecture, we will talk more about production of consonants. We'll see how place of articulation, manner of articulation, state of the larynx, and a bit about vowels if there is time. So, we are now looking at the International Phonetic Alphabet, and we already discussed this in the previous class, that all these sounds are represented in letters similar to English in a few instances. However, in other instances like the, or in the representation of ng or ny or other sounds like sh, zh, these are not what we see in English. Now, coming back to speech production. To produce speech, as we have already discussed, air must flow out from the lungs through the vocal tract and the vocal folds. It could also come out through the nasal cavity, the mouth or the oral cavity. And then the vocal folds will vibrate for the production of some voice sounds. And also air releases through the nose for certain sounds which are nasal or nasalized. Okay. Now, what are the important parts of that articulation? So, the three important things which we already mentioned the other day: place of articulation, manner of articulation, and vocal fold voicing. There may be others which characterize the sounds that we produce, like airflow through nasal cavity or lip rounding. So, remember that these are important things in articulation. In place of articulation, what are the places which play a role in the production of sounds? So, these are the lips, the tongue tip, the tongue body, and the tongue has various parts within it. So, the tongue is the tongue tip, the tongue blade, the tongue body. All these parts of the tongue play different roles while producing speech. And the larynx is another articulator which plays a very important role and which obstruct the air flowing out of the lungs. Whereas vowels are different because they are always relatively open. We can describe types of consonants in terms of how much obstruction is involved. Nearly all sounds of the languages of the world are produced through the pulmonic airstream, which means the air is pushed out of the lungs. Okay, this is the pulmonic airstream where the air is pushed out of the lungs. Sometimes we may have glottalic airstream, air is pushed out of the glottis, and then sometimes we might have the velaric airstream, where from the velic region, and these are where clicks are produced. The velaric airstream, the air trapped within the articulators there and released, that produce a sound called clicks. So we have already discussed these things. Pulmonic can produce implosives, ejectives, and the velaric airstream can produce clicks, etc. So this is the vocal tract, and we can see that there is a passage through which air will pass out from the lungs for the production of specifically speech sounds. And this air is then modified by the vocal tract. So various places within this vocal tract will modulate the sound. So the air which goes through the vocal tract may be modified at the teeth region. It may be modified here, these are called dental sounds, upper teeth, lower teeth, and then this gum, the area behind the upper teeth, which is in the shape of a ridge, which plays a very important role in the production of very many sounds, is called the alveolar ridge. And then we have the hard palate, which you will feel with your tongue. If you take it backwards, you'll feel the hard palate. Of course, the nasal cavity is not a part of this oral tract. It's a nasal cavity which is accessed for the production of sounds when the velum, this velum part, is lowered, then air can move out through the nasal cavity, producing nasal sounds. And then we have the pharyngeal region, the epiglottis, which actually shuts off the passage through which our food passes, and then we have the esophagus, and we also have the trachea. So it's important to remember that some of these articulators can move, and these are the lips, which also produces very specific sounds. The tongue can move and can produce specific sounds which are the result of the obstruction that the tongue creates inside the vocal cavity, and then the glottis and the uvula. So the glottis consists of the vocal folds which can vibrate and give very distinct quality to sounds, or can produce sounds in the glottal because of the glottalic airstream. And then there are uvular sounds which are produced. The uvula is the fleshy part towards the end where the palate ends. The fleshy hanging part is called the uvula. So these are your descriptions of the various parts of the vocal tract that we discussed so far. And important things to remember here is that the alveolar ridge plays a very crucial role in the production of sounds. The palate is important, the soft palate of the velum, which ends in the uvula. And if the velum is raised, this closes the velopharyngeal port, preventing the passage of air from the oral to the nasal cavity. However, if it is lowered, so a lot depends on the lowering or the raising of the velum. Again, these are the parts that we just discussed. The tongue is sort of a muscular body which we can divide into the tip, the body, root, and the epiglottis. The role of the epiglottis is to cover the trachea, allowing the food through the esophagus. This is another view. This is an X-ray which shows the cavities of the oral cavity and the nasal cavity. So These are the two cavities which are used for the production of sounds. So, the larynx is extremely important for humans in the production of speech sounds. It is a sort of a valve. It's encased in cartilage, and then it opens wide during breathing and closes when you swallow. So, coming to now manner of articulation. Stops involve complete obstruction and sudden release of the air. Those are the two important parts of the production of stop sounds. So, there should be full closure for the production of stop sounds. Nasals also involve complete closure in the oral cavity, but the air release is through the nasal cavity. Fricatives have partial construction and slow release, and the air is pushed out through a narrow passage slowly, unlike that of stops. So, very often, because of narrow passage, we have a hissing sound when we have fricatives. And an affricate is a term used for sequences made with the same articulator. So, and then approximants of the least obstruction, lesser than fricatives but more than vowels. So, then we have these are approximants in English. For instance, l, r, y, w. In l, the tip of the tongue makes full contact with the alveolar ridge, but the air is released on both sides of the tongue. So, let us now have a look at the manner of articulation. Here, what you can visualize is the production of, for instance, t and d, for instance. So, as t and d are being produced, there is complete obstruction and then the air is released. And then, unlike the oral stop, for the production of nasals now, what you can see importantly is the lowering of the velum. The velum is lowered and hence the air can be, once the velum is lowered, the air can pass through the nasal cavity. For the production of trill-like sounds, so there you can see that you have very short periods of obstructions for the production of trills like r. So, with slower beating, we have tap or flap. We will discuss these differences between trills, taps and flaps when you are discussing sounds of the world's languages in greater detail. So, unlike the stop before, so the production of which we had to make a complete obstruction. For the production of fricative, for instance, you can see that it's partial. There's partial obstruction here when you're producing, suppose a fricative sound like z or s, you can see that the obstruction is partial. We will discuss lateral fricatives later when we discuss sounds of the world's languages. Now, the least obstruction, as we said, is when we have approximants. So, here we have r, y, w, and then we have l. So, that was to show you through video descriptions as to how these sounds are produced. And we are going to discuss more of these sounds when we discuss the sounds of the world's languages. Coming now to the place of articulation then, so when the lips are involved, then we have bilabials. When both the teeth and the lower lip are involved in the production of the consonants, so where you have a constriction of the upper teeth with the lower lip, then we have labiodentals, and dentals obviously involves the constriction of the tongue tip and the upper teeth. So, and then there are the other types called post-alveolars like sh, zh in English, which involve constriction of tongue tip and palate and the just behind the alveolar ridge. So, palatals involve constriction of the tongue body and the palate. Then we have the velars, where the tongue body make a constriction in the velic region. And then we have glottals, which involve constriction of the vocal folds. So let's look at place of articulation. So this is bilabial. This involves the constriction happening there at the lip region. Okay. Now, whereas this involves the lower lip and the upper teeth. The lower lip and the upper teeth, labiodental. Then we have the tip of the tongue making a constriction there at the upper teeth to produce a dental sound, th and z. There are other places of articulation like alveolar, as we discussed. Here you can see the tip of the tongue makes a constriction at the gum area of the behind the upper teeth. Then we have a post-alveolar consonants like sh, zh. You can see that it's moving, the tongue is moving towards the palatal region, the post-alveolar region of the palate. And then we have retroflex consonants. We will discuss these later on, and we'll move on to discuss palatal sounds, and where you can see the tongue body moves towards the upper palate. The velar region, where the tongue body moves towards the velar region, and then the uvular, you can see that the back of the tongue makes a constriction at the uvular part. Uvular, velar, palatal. And then there are languages of the world which produces pharyngeal sounds. And this is what would happen in a pharyngeal sound, that the back of the tongue would make a constriction in the pharynx region, and whereas for glottal sound, which is making a constriction. So talking about the glottis, this is the larynx, which we already saw the other day. So it is encased in all these cartilages. Okay, so you have the cricoid cartilage, the thyroid cartilage, the arytenoid, and the other parts. What is important here are these two flaps, which vibrate to produce most of the voice sounds that we can hear. So this is what happens in the production of voice sounds. This is called the state of the larynx. Is it voicing or not? As you can see in the diagram, that we have a voicing sound here. We can classify consonants in terms of state of larynx during their production, that is, whether there is voicing or whether it's the state of the larynx is voiceless. Now we have understood so far what is manner of articulation. It could be stop, fricative, approximant, you have complete closure or partial, as you saw. And then we have place of articulation, the place inside the vocal tract where some obstruction is made to produce a sound, and that is your place of articulation. The third important characteristic of sounds is called voicing. Now, how do you understand voicing? We often ask our students to do a test in the class. The test is to produce two sounds, a voice sound and a voiceless sounds together. So you can try this for yourself. You can try producing a v sound and a f sound, or a z sound and a s sound. Make it longer and put your hands right here where you can hear a. So for boys it's easier, for men it's easier. You can put it above the Adam's apple, and for women also you can feel the vibration there at that position of your throat. And whenever you're producing the voice sound like v or z, you can feel the vibration, unlike when you're producing the voiceless sound like s or f, you cannot hear the voicing. So that is a test we ask our students to do in class, so that they can feel the voicing for themselves. This is important because very often beginners in phonetics and phonology find difficult to make a distinction between voice and voiceless. This is very common among the students that I've taught over the years, because every sound is produced as a syllable. So by the time you finish the voiceless part, the voice part of the vowel already starts, and that's why it's difficult if you are a beginner to distinguish between voiced and voiceless sound. This, the experiment that we just did, helps you to see for yourself where there is vibration of the vocal folds and where you don't have the vibration. So sounds produced with the vibrating vocal cords are said to be voiced, and those produced without vocal cord vibration are voiceless. So in English, for instance, all these consonants are voiced. B, D, G, V, Z, Z, J, M, N, Ng, L, R, Y, W. All these consonants are voiced, and we have a fewer voiceless consonants, P, T, K, F, Th, S, and Sh and H. During the production of these voiceless consonants, the glottis is open, spread, and air passes through the glottis without any vibration. There are various languages of the world which have different voicing, have different manner of articulation, and for instance, I would like to draw your attention to Hindi stop consonants. Now let us look at these Hindi stop consonants. So unlike what we saw in English, where we have the dental fricatives, okay, and we did not have any dental stops. Now in language like Hindi, for instance, we'd find dental stops, we'd find post-alveolar stops, we'd find palato-alveolar stops, we'd find velar stops. So after bilabial, in English, for instance, the dental part is not there. Now apart from having all these places of articulation, another important characteristic of sounds in a language like Hindi would be that there are two important things to see here. One is that Hindi has a type of consonant called retroflex consonant. The other important thing is to look at this contrast. So in Hindi now, so look at the bilabial or dental sounds, you have contrasts across all these positions. So we have not just a voiced and voiceless aspirated, we have the voiceless unaspirated, the voiceless aspirated, as well as voiced aspirate. So we have like bal, pal, pal, bhal. So we know from our previous class that aspiration is the production of extra release, extra air in the release of a sound, or sometimes also at the closure. So those are different, but these are produced at the time of the release of the consonant of a voiceless aspirated sound. Now Hindi and many Indian languages are unique for production of voiced aspirates. So this is produced, so in the production of which the vocal folds are vibrating, not just the vocal folds are vibrating, there is a breathiness in the phonation in the state of the larynx. So we have voiced aspirate, voiceless aspirated, voiceless unaspirated, and voiced. And this also is seen now in dental place of articulation. You have the voiced, voiceless, you have the voiceless aspirated, and you have the voiced aspirate. Again in the post-alveolar part, you have dal, tal, thal, and dhal. Now this is where it becomes interesting, because these sounds are produced by what is called the retroflexion. Now what is retroflexion? Let us go back to one of the previous slides. So this is a retroflex. What is unique about this movement is that we can see that the tongue curls. Okay, so the tip of the tongue curls or becomes concave to produce an articulation like that of retroflex. So now let us look at the English consonant chart, and we will see that in English we have bilabial, we have labiodental, but we have stops only which are bilabial, alveolar and velar. But in a language like Hindi, we saw that we can have bilabial, dental, post-alveolar and velar as well. So across all these places of articulation, we can have stops. So not just the voiceless and voiced counterparts, the aspirated and unaspirated counterparts, as well as the voiced aspirated counterparts. So this is how languages can differ in the production of sounds, in the manner of articulation of sounds. And if you look at the English consonant inventory, then we see that many of these places are. So there will be languages which will have, for instance, dental stops, post-alveolar stops, will have glottal stops, and will have bilabial fricatives or lateral fricatives. So there are, to a certain extent possible, languages employ the possibilities provided by our vocal tract to produce distinctive sounds. However, some are impossible to produce, and so we talked about this in the beginning of the course. Articulatory ease is important, but to maintain distinctions, languages will have inventory of consonants which will help them to have a maximum number of contrasts in the production of in maintaining a lexicon which is mostly contrastive and can have meaning differences between the words, so that if two words are similar in the production, then there are very many homophones in languages, but their number cannot be extremely large, then that will be a difficulty in maintaining the contrast. So continuing our discussion on consonants and how we can see that different languages will make use of different places of articulation. So we just now saw some Hindi examples where we saw that Hindi has dental stops and Hindi has alveolar, post-alveolar retroflex stops, has palato-alveolar, affricate. So basically all these 5 places of articulation are possible, along with another complication, that of retroflex in the inventory of consonants. So Hindi is well known for these distinctions, 4-way distinction along the line of dental and post-alveolar and palato-alveolar, and where all these sounds can be retroflex, so where the post-alveolar series are all retroflex here. And then we have this dental series, and where the voiced dental stop, then there is a voiceless dental stop, there is a voiceless aspirated dental stop, and then there is a voiced aspirate or breathy stop, and which are all dental. Similarly, in the post-alveolar series also, you will find that we have the voiced, voiceless, corresponding voiceless aspirate and the voiced aspirate or breathy, and distinction is not just with regard to post-alveolar, they are also retroflex. And then, whereas these are dental, these are post-alveolar as well as retroflex. And then it's also possible in Hindi to have these affricates. Okay, So as we know, Affricates are a sort of combination of two manner of articulation. So it would here you would have a stop and a fricative. So, and note that along with being palato-alveolar in Hindi, they can also be retroflex. So we have voiced, voiceless unaspirated, voiceless aspirated, and voiced aspirated. And then finally the velar, where you have the commonly seen voiced velar stop, the voiceless velar stop, the voiceless aspirated velar stop, and then the voiced aspirated breathy velar stop. So you have, and of course the what we see in English, the voiced versus voiceless, unaspirated voiceless, aspirated voiced aspirated, all the four possibilities are present in Hindi. So you can see the four-way contrast here along the line of voiceless unaspirated, voiceless aspirated, and voiced aspirated. So along this line, these four contrasts are made, and then along the line of place of articulation, so we have bilabial to dental to post-alveolar, palato-alveolar, velar. So, and then here we have these affricates. Okay, and also along with this being dental, these are retroflex. Later, when we will study the sounds of the world's languages, diversity in the world's languages, we will see how Hindi retroflex could be more apical rather than subapical. So we will learn about those distinctions later. So at the moment, it's important to see that in the stop inventory of Hindi, more distinctions are used because of the possibility of having dental sounds and having stop sounds at all these possible levels of contrast. So of course there are much more complications that can be seen in languages of the world. This inventory is different from English primarily because Hindi has a contrast between voiceless unaspirated and voiceless aspirated, whereas in English this is allophonic. There is no contrast between the voiceless unaspirated and the voiceless aspirated. So that is a contrast which is there in Hindi, which is absent in English. The other contrasts which are absent in English are the dental sounds. Instead, in English we have alveolar in English. And in English again, the retroflex sounds are not there. So, and in Hindi, there is a contrast available between voiced, voiceless unaspirated, voiceless aspirated, and voiced aspirated for the retroflex stops. So this series is pretty unique to South Asian languages and also seen in Hindi, also seen in other languages like Sindhi, etc. So retroflexion and voiced aspirates, which are again characteristics of South Asian languages. So one group of South Asian languages, the Indo-Aryan group of language. So you would the voiced aspirates are common. So these are features of some groups of languages and not other groups of language, and that's why we do not see that in Hindi, in English. And also another common contrast that we saw here is the velar one, which is also English has the velar stop, the voiced velar stop, and the voiceless velar stop. So this contrast is available in English. However, the contrast which is not available in English is this one that we see here, kal versus khal, so which is contrastive and mean two different words in this language. Finally, we also have the voiced aspirate here, so which I again mentioned just now. And I would again like to emphasize these voiced aspirates are commonly seen in South Asian languages, and therefore this is not there in English. So this was a small comparison of the differences which may be there in languages. We saw that some contrasts which are not there in English may be there as a contrastive in another language. So we saw an Assamese example a while ago, and now we see these Hindi examples where we see the contrast between the voiceless unaspirated and voiceless aspirate. And this is seen throughout the inventory at all places of articulation. And the other thing that we saw here is that languages may have, so whereas English may have alveolar and Hindi has dental, and these two are commonly seen in the languages of the world, both the alveolar place of articulation, dental place of articulation. In our later sections, we will see how dental and alveolar gestures could be different. So they both could exploit different places of the tongue while making the articulation. So while one can be laminal, the other can be apical, and we will look at those differences as we go along in this course. So we come to the end of this lecture on consonants, and giving you a broad overview of consonants, place of articulation, manner of articulation and voicing, the three most important characteristics. And in the next section, after we study acoustic phonetics, we will also study how there can be many more differences in the languages of the world, and many more different, quite a few other places of articulation and airstream mechanisms which can be possible to be used in the languages of the world. And coming now to the conclusion, consonants are movements at the beginning or end of a vowel, because consonants by themselves do not occur. There has to be a vowel. So the vowels are sort of the main parts of a word, and then the consonants are can be sort of gestures which move from a neutral state to another position. So that is one way of looking at consonants. Of course, we have to remember all the other stages are there in the production of consonants, that you have obstruction, that you have release stage, etc. But if you think about the obstruction and the release, so you can see that it happens as certain gestures moving from a neutral state to another state, because there's always a vowel which has to be articulated as well along with the consonant. So the targets of these gestures give us the realization of consonants. So we will talk more about gestures, about targets and gestures in the section where we are going to talk about diversity in the languages of the world. So these three questions, the answer to these three questions give you description of consonants. So what were the vocal folds doing during the production of the consonant? So which means what is the state of the glottis? So essentially this will tell you whether the consonant was voiced or voiceless. Secondly, the question is, where in the mouth is the sound made? This is a place of articulation. So where was the obstruction, and the place where the target, and the gesture. So what was the target of the gesture? So you could also think about that in terms of gestural phonology. And then also what happens to the stream of air from the lungs, which means the manner of articulation. So was it released like as in a stop, or in a fricative, or affricate, or nasal, or approximant, etc. So how was the stream of air released? So where was the obstruction, how was it released, and what is the state of the glottis? So these three things are sort of very preliminary, gives you a preliminary idea about what consonants, how you would understand the articulation of consonants. So okay, so what were the vocal folds doing? They must be vibrating like this. Then you would have a voice sound. Or if they were neutral like this, then you would have a voiceless sound. And an implosive sound. So manner of articulation. So you have a plosive, you have a nasal where the air is moving out of the nasal cavity also while making a obstruction there inside the vocal cavity, and then you can also have a trill as in the one here. So you can see the rapid tapping of the tapping or flapping of the tongue blade, and there. Where in the mouth the sound is made, which is the place of articulation, where do you have the constriction? In bilabial, it's the lips. In labiodental, it is the lower lip and upper teeth. And in dental, you have the tongue making an obstruction with the back of the upper teeth. So here you would have consonants like purba, here furva, and here the dental fricatives, the. More things that we would need to cover in the conclusion is that often what we need to remember is that there are plenty of dialectal differences when we talk about consonants. Just now we showed these two dental fricatives, and the. So now one dialectal difference there is the difference between interdental and dental. So interdental is when the tongue is placed between the two, between the upper teeth and the lower teeth, and then the release happens there. Unlike interdental, the dental is when the tip of the tongue makes an obstruction on the side of the back of the upper teeth. So there is an obstruction there, and which should account for the differences between interdental and dental. It is known that British English speakers and American English speakers, some dialects of American English differ as to whether the sound produced is would be interdental or dental. It is known that in American English you would find more interdental productions than in British English, which would normally be dental. So that was with regard to the two fricatives, dental fricatives in English. So you have dialectal differences, and that's not the only difference that you would find in terms of dialectal differences. There are many others as well. So, but that is one thing that you can keep in mind and try to hear the difference if you get an opportunity. Another thing to keep in mind is that it is not easy to feel what the tongue and lips are doing while producing a consonant. So the movements are pretty fast for us to notice what we did with the tongue and lips when we said something. And then as a result, so when we pronounce these approximants, for instance, ya and wa, we can feel here that the tongue goes towards the palatal region, and for wa, actually there are two types of movements, so we can feel the lip rounding, and but also the back of the tongue goes up. So these are things that we might notice while we are producing consonants. To remember that there are dialectal differences, that we are always not conscious, that we cannot consciously feel the differences while we are producing sounds. So it may not be easy to keep a tab on the productions of our even if we are consciously trying. And finally, to sum up, these are the consonants of English, and we have already seen them, the bilabial stops and these labiodental dental stops. As we already know, we saw that this place is occupied in Hindi, not occupied in English. The dental stop place, labiodental stops not there, and then we have alveolar stops, post-alveolar not there, palatal not there, and velar. And these three are actually most commonly seen in the languages of the world, that bilabial stops, alveolar stops, and velar stops. We have more fricatives in English than we have stops. So we do not have bilabial stops. we have labiodental fricatives, we have dental fricatives, you have alveolar, we have post-alveolar, palatal not there, velar not there, and this is called the glottal fricative in English. So it's called glottal fricative, it's there pushed out from the glottal region, but it's important to note that in the production of this voiceless sound in English, it very often takes the, if we look at the spectrograms, if we look at the acoustics of how we'll very often see that it takes the shape or formants of the surrounding vowels. Then coming to affricates, we have far fewer affricates, and this is true for almost all languages of the world. There are only two post-alveolar affricates in English, ch and j, and all the other places are not occupied. We have the nasal stops, we have the bilabial nasal, the labiodental nasal, and velar stops, and these stops, and we have the approximants were l and y, and also we do not have lateral approximant and okay. The reason that I am crossing these places is to show that only a few of the places which are possible are occupied in English. Now, when we study diversity in the world's language, we will see how many others are possible in the language of the world, how common they are, and what is absolutely not possible in the languages of the world. So, for the time being, we see that English has uses almost most of the places of articulation, and depending on the manner of articulation, of course, and English has almost all the manner of articulation as well, but again does not have each and every manner of articulation for each and every place, and similarly each and every place is not occupied by, is not exploited by each and every manner of articulation. So these are the consonants in English, and that brings us to closer to wrapping up this part of the lecture on consonants. And very important things to remember again is that consonants in a word overlap. So and also consonants in a word are influenced by the surrounding vowels. So hence rip and rap will have slight differences because the following vowels are different, even though they are pretty close as words. Similarly, very similar words like cart, crate, and cat, the acoustics of these sounds would be different because of the environment and because of its different vowels, the consonants, etc., which will influence the consonant. And we have to remember that these are differences that are environmentally affected, that is the surrounding sounds, and there will be subtle differences always in the acoustics of sounds, no matter what sound it is. So in the next class we will talk about vowels and the cardinal vowel system, etc. For the time being, for now, it is important to remember that consonants involve obstruction, consonants involve modification of the air pushed out of the lungs, that is, in the release is important. The state of the glottis is important, whether the glottis was whether it was vibrating or it was in a neutral state, it is important. And the glottis plays far more different roles also, as we will see later on, what is called phonation. There again the glottis plays an independent role and gives its own color to different vowels and consonants. So the breathiness or the creakiness, etc., can be effects, can be the colors given by the glottis to different sounds. So apart from voicing, the glottis plays other roles as well in the articulation of various sounds. So the glottis is very important it gives the spectral shape, and then it gives the spectral shape, and then it's filtered in the rest of the vocal tract, whatever is pushed out of the glottis. So the state of the glottis tells you about voicing. This is a basic thing, one. Secondly, it is where you have the obstruction inside the vocal tract, and then place of articulation. And finally, manner of articulation. We are not saying that these three alone defines everything that we need to know about consonants, but these are the preliminary things that we need to know about consonants. Apart from that, there are other things, there's nasalization, there's lip rounding, as we said, there are other influences, the other things done by the glottis like phonation, etc., which we are not studying now. So these are the preliminary things that we need to remember about consonants. Thank you very much for watching. Stay tuned for the next lecture, which is on vowels. Thank you.